back to Fox and Friends, 16 minutes now past the hour. Well, should your nurse become your primary care provider? In 28 states right now, nurse practitioners may soon have the power to do just that. That's because those states are looking to fill a future doctor shortage by giving nurses that same authority. Here for a fair and balanced debate on this issue, Susan Apold. She's a doctor and a nurse practitioner, and Dr. Mario Mata. He's a cardiologist and president of the Massachusetts Medical Society. Welcome to both of you doctors this morning.
Good morning.
Dr. Apold, let me start with you this morning. Why should nurses be allowed to play doctor?
Well, actually, nurses don't want to play doctor. Nurses want to be nurse practitioners. The real point here is that nurse practitioners provide safe, effective, quality care, and we've been doing that for over 40 years. What we're seeking to do is continue to practice safe, quality care autonomously with no barriers or restrictions to our practice.
Dr. Mata, that sounds fair and reasonable. What's the problem here?
We have no problem with nurse practitioners fulfilling the role that they're designed to do. And there's quite frankly a need, and there's an expanding role for them. The only issue of controversy is whether they should have an independent practice.
And Dr. Apold, the question though is, a lot of the criticism I'm hearing too is that a lot of this is routine, right? That these nurse practitioners are going to handle routine care. The criticism I'm hearing is that there's nothing routine in the medical field. What do you say to that?
Indeed, there is nothing routine in medicine and in nursing. What nurse practitioners are seeking to do is practice to the full extent of our license. That means that we are able to provide care unsupervised, and we are not seeking independent practice. In fact, no healthcare provider in the United States of America practices independently. We're seeking autonomous practice.
Dr. Mata, you know what the argument is, right? There's a huge doctor shortage coming down the pike. 150,000 fewer doctors in 15 years. You're going to need the help.
We do need the help, and as I said, in fact, in my practice, we have a nurse practitioner, and there are nurse practitioners integrated into the hospital care that I practice at. Again, there is no issue with that. Nurse practitioners will fulfill a very important role, including the doctor of nurses that is being proposed. The issue is, can they be completely autonomous, if I'll use her phrase. Being autonomous is a problem. The scope of practice is much different, and the training is different, and you don't know, if you can say you can have a limited practice, but you don't know what's going to come through the door. In a home environment, say a medical home, or in a hospital environment where collaboration can occur, then they fulfill a great role. But an independent, autonomous practice, I have a problem with that, and as do most people.
Dr. Apold, what do you say to that?
I say that right now, when we say collaboration and supervision in the United States, there's an implication that there's a physician looking over our shoulder. Here in New York State, where I practice, I have a collaborative practice agreement, but that collaborative practice agreement does not assure quality. Indeed, a collaborative practice agreement in New York State is a retrospective chart review. There is no need for a physician on site. There is no need, indeed, for any mileage requirement. I can have a physician in Rochester be a collaborating physician with me in New York. A retrospective chart review is not someone looking over my shoulder. And indeed, an interesting point and an important one is that there are 16 states in the United States where there is no collaboration or supervision, and nurses do and have been practicing autonomously.
Well, I think one thing's clear from this debate. Both of you guys are smart as a whip, and I'd be in good hands with either of you guys this morning. Dr. Susan Apold, Dr. Mario Mata, thanks for joining us this morning, this Sunday morning on Fox and Friends.
Thank you.